task 43, I'm going to be doing an IV catheter in the cephalic vein of a dog. So our tray of supplies consists of our sterile gauze. We've got our vet wrap here, our catheter, our flushes, and our injection cap. And then over here we've got our aseptic scrubs and our alcohol flush and our clippers. So first we're going to go ahead and begin to clip the leg. And this patient's had a catheter before, but we're going to just remove all the extra hair. So now that we have clipped, we're going to go ahead and start our scrubbing process. So we're going to start with our chlorhexidine and then our alcohol scrub, and we're going to do this 3 times. I'm going to go ahead and flush my catheter.
Yeah, you're right. All right, buddy.
We're going to keep this in its container. Our injection plug ready. And we're going to get our gauze ready. Alright, so then I'm just going to take one of these sterile gauze. We're going to place it distal to the site. I'm going to put my finger beside the vein. Insert the needle with the bevel up. So now that I have my flash, I did have to redirect once, but I'm going to advance my catheter. And she's going to hold off there. I'm just going to tighten that injection plug, remove my sterile gauze. Alright. And now I'm going to flush the catheter and make sure that we're in the vein. So I'm not getting any resistance. I can feel above and it's flushing. I don't see anything swelling or blowing. Okay, and then I'm going to continue my taping. Alright, and then we're going to do our vet wrap, which was right here. And then we are going to place it below the catheter, and then we want to make sure we cover that catheter tip up to keep any debris or bacteria or anything, keep it as clean as possible, and that's it. So IV catheters need to be checked frequently throughout the day to make sure that there's no swelling above the catheter site. That could mean that if the patient is on fluids, that the vein has blown and they're just getting fluid to their subcutaneous tissue. You also want to check for swelling distal to the catheter site, because that could mean that the patient has the, whoever did the taping may have taped too tight and it can cause swelling, and that would need to be retaped. You also want to check for any tenderness around the catheter, because that could be a complication. The catheter could become infected if not used with proper aseptic technique. You also just want to flush the catheter at least every 2 to 4 hours if the patient is on constant fluids, to make sure that the catheter is still patent, and make sure that they're not forming any blood clots or anything like that. You also just want to make sure that when you're putting the patient back in the kennel, that you put an e-collar around the patient. That way they can't chew their catheter out, because that will happen immediately for most animals. You also want to, we have vet wrap here that has it's called no chew vet wrap, and that helps kind of defer them away from wanting to chew on that, but you can't really trust that, so I always just stick with the e-collar because I know that works.